I am Wilson on Marshall. Today, it's all about hypertension, the causes, the symptoms, treatment, or when I say management. If you take a look at the country today, even globally, get to realize that over 1.8 billion persons or people are suffering from this particular term or word, hypertension. According to reports in Lagos State, over 8 million people are exposed to hypertension. You get to hear, do you know your blood pressure? Have you checked to get to know what is really happening psychologically, emotionally? You know that all these things put together do have a way, according to research, increase the tension in your body, the pressure in your blood. How does it affect us as an individual or group of persons, even family members? And that is why I invited a doctor here to really throw more light on this particular topic. Join me to welcome medical practitioner, Dr. Onovo Koko. Welcome to Healthy Living.
Thank you, Mr. Abacha.
Appreciate your coming. All right, hypertension, and of course hypertension. Many people have been hearing this word, but they don't know the definition or the meaning of this word. Let's start off with a particular word, hypertension. What does it mean?
Okay, well, when we say hypertension, it has to do with an elevated blood pressure at a sustained level. Now, you actually rightly mentioned that some persons will be hearing about the term hypertension. When you look at hyper, it means something that is higher. When you look at tension, you see the same thing like normal taste. So it has to do with force. In the same way, you also have hypotension, which means the force is lower. Then before you now have the normal, let me use the word normal tension. But however, blood pressure without which we cannot survive, is the pressure with which the heart pumps blood into the vessels. The particular vessel in question here is the artery. So there is a normal pressure at which it can actually pump out. Though we can't just say this is it, we just say, okay, optimally, it should be 120/80. This is where what gets some persons confused. The 120 is the force with which the heart pumps out blood. The 80 is the pressure that is remaining in the heart after it has pumped out the blood. So you have the pressure at which it pumps out the blood and the pressure at which that remains within the heart. So if that pressure that the heart is used to pump out the blood is higher than what is necessary, we have a borderline of 140/90. Attention. Number one factor is age. Age is something we can't do anything about. You that you want to get old, if you have your time, you want to get up to like 150. But age, as your age increases, you're already at risk. Now, for things about hypertension and some other ailments and such, you don't have like a direct cause. Let's say, for example, if I should fall from this place, I'll have a broken leg. If you ask me or what happened, you say, okay, I had a broken leg. But for cases like hypertension, you have what we call risk factors. It is risk factors that we actually consider rather than say causes. So, like I mentioned, age. Those days it used to be maybe from 40, but as the cases are going by, we are seeing people who are 35, 30, who are actually hypertensive. So age is a risk factor. So as the age increases, there's tendency that, oh, this person could be at risk. But however, you still have people who are 70, 80, they are not hypertensive. That's how we call it risk factors. It could also be hereditary. Probably the parents, the father, the mother, they have history of being hypertensive. So that person could also be hypertensive also. Then you also have the activities you get involved in. We could call them stressors.
Stressors.
Yes, they could also give room for that. Then there are also some kind of medical condition, underlying medical condition, probably maybe like kidney problem, for example, could also give room to having elevated blood pressure. Size, you know. So those are just some of those risk factors that could actually put us at risk, or also this person is at risk of developing hypertension. Not only just say maybe a cause, but you have risk
factors.
Yes.
Now, some are saying that one of the risk factors can be tied to dieting. How true is that? What you eat, what you drink. How true is that?
Yeah, what you eat, what you drink. I talked about our body size. Yes. You understand? So what you eat could be responsible for your body. So people who are kind of overweight or obese can also be at risk of developing hypertension. I get it. But talking about some kind of specific diet, the diet will have issue to be on your weight, as the case may be. What is it because of that food? You just attribute it to say this food could make you to develop hypertension or not.
So what about some of the people that's taking in a lot of carbohydrates, a lot of fatty food, and maybe a lot of processed food can give rise to hypertension or high blood pressure?
Well, the only thing, what we could actually link to that, because we are talking about hypertension as it is. Hypertension is one of the, I don't want to put some big terms here, cardiovascular disease. When we say cardiovascular, it has to do with the heart and the blood vessels. So some of those food we're talking about now, they could give room for other cardiovascular diseases, but not necessarily hypertension. Let's say, for example, bigger diameter, the pressure is lower. But if maybe you have a pipe of maybe like 10 millimeters, and you have another pipe that is maybe like 3 millimeters, and the same quantity of water will be made to pass through, you realize that the pressure in the bigger pipe will be lower than the pressure in the smaller pipe. So in the same way, when you eat some of all those processed food that you actually talked about, they will narrow the blood vessel, thereby increasing the pressure with which the heart will be pumping.
All right. Some of them are outside diets or what we eat or drink. Smoking do have a thing or two to do with hypertension. How true is this?
It's also still a risk factor. It's still a risk factor that one cannot actually tie to it. You know, but sometimes smoking is dangerous to your health.
Yeah.
Smoking is not good. There's nothing good about smoking, as the case may be, but it's not enough to just carry it and tie it to, oh, because you are smoking, you have hypertension. No. But we also have cases to say many persons who are smoking also may be having hypertension, so it could be from other causes, but not necessarily smoking.
All right, so what about worrying? Thinking so much, be like, you think too much, go and watch out for your blood pressure may just become hypertensive. How true is that? Someone that thinks so much, worries so much, is that person at the risk of having hypertension?
When we say worry, it's more of a state of anxiety. It's more of a state of anxiety. So when you talk about worry, like I mentioned, stressors, things that gives you stress. So when you are kind of worried, if there is something you can actually solve on your own, you don't need to worry about it. You just go do what you want to do and you get back. But when is that making you anxious? Is that making you anxious? Of course, at that state of anxiety, there are some hormones that are being released. Of course, your heart beating faster than it should be, and so many other systemic changes taking place. So that could also trigger. So we count it as part of the stressors.
Part of the stressors?
Yes.
All right. All right. Some of the people that hypertension can give rise to either kidney problems or can give rise to stroke. How true is this palpable fear?
Well, it's not just to be a palpable fear. It's a fact that we need to understand. Now, the kidney, they have blood vessels. And we're talking about forces, sustained force. If there's a sustained force on a particular vessel, what could happen? You used to play with balloon. When you blow air into your balloon, it becomes so tense, and the air still keep coming in. What happens later? The balloon will burst. So for the kidney, yes. In fact, the kidney's case is a little bit worrisome. You know, I mentioned that kidney disease can actually cause elevated blood pressure, and hypertension can destroy the kidney. So, of course, you see that
vice versa
going on. Then the same thing for stroke. In the brain, we have blood vessels in the brain. So if the pressure is also high, so that's why we have like two types of stroke. The one that could be due to insufficient blood flow to the brain, or because of there is compression. Because every part of your body is represented in the brain. So if there is either no adequate supply of blood to that part of the brain, it could die off. Or if there is maybe like a rupture of a blood vessel in the brain, of course, the blood would flow in to form some kind of a thick clot and to be compressing some part of the brain. So like I said, every part of your body is represented in the brain. So the part that is being compressed, automatically it will be showing on the outside. If it is the eyes, if it's the lips or wherever. So that's what will be manifested as the stroke, because the stroke is a part of the brain has been affected. Of course, the eyes also, there are vessels in the eye. So if those vessels should rupture, obviously it will not perform the function that it would need to perform. So you could see that blindness. Yes, the person could be, every other thing could just be okay. The person is looking at you, but the person is not seeing because some damages have actually come up inside. Even the heart itself that pumps the blood, hypertension can also affect the heart, and before you know it, the heart will start failing.
In what ways can hypertension affect the heart?
Good. When I will still bring you back to the use of the borehole. The borehole. Now, the borehole has different horsepower. So if you are like using a lower horsepower to power a place that should have been of a higher horsepower, and you keep using it, what will happen? The machine will pack up. If you have a car that should have traveled maybe after some kilometers, and the car should slow down, now you just continue to fire the car. Or let's take, for example, you have a generator also. It has the tank of generator could be on. If the fuel finishes, the generator will go off. Now, generator that is supposed to have maybe like a 2-liter tank, you now go and put like 10 liter. It means that generator will keep working. It will get to a point, it will just fail. So the same thing goes with the heart. So when the pressure is more, so the heart will be working higher than the capacity that is expected for it to work. And before you know it will pack up.
Wow. Interesting. Well, some are saying that hypertension can just be a precursor to other major ailments in the body. How true is that?
Well, precursor to other major ailments, yes, no. Yes, because some of these other organs and systems, they require blood flow. So if maybe due to hypertension, some of those vessels rupture, it means that they will be supplying nutrients to where they ought to have supplied nutrients. So from that, it could actually develop that. But I said no, because it may not necessarily, hypertension may not make you to develop something like diabetes. It may not make you to develop maybe some other ailments.
But it can make it develop some heart-related ailments.
Of course, because of the pressure.
Even stroke.
Of course, I already mentioned stroke already. So it could actually cause that.
All right, now can this condition be treated? Some are saying, well, once you have hypertension or you're hypertensive, you just cannot treat it. Rather, you start managing it. So what's between it being treated and it being managed?
Well, I think the term to use there is cure.
Cure?
Yes, the term to use there is cure. There is no cure for hypertension. It is about, it can be treated. It can be managed.
In what way?
But however, the only way, first and foremost, for you to know if you're hypertensive is through your blood pressure check. There's no symptom you're going to have that will tell you, oh, I'm hypertensive, that's why I'm having this symptom. No. It's not like malaria where you'll be having headache, maybe your body is hot or something, use that to say, okay, I think I'm having malaria. For hypertension, no. As you are seated there, I don't know if you are feeling your heartbeat. If I have to tell you to locate where your heartbeat is, it may take some time to locate it. The heart is working quietly. So in the same way, if you don't check your blood pressure, using the blood pressure machine to check your blood pressure, there's no way you can be diagnosed of being hypertensive. I can't look at you, I can't look at your eye, I can't touch any part of your body and tell you you're hypertensive. I have to tie the cuff on your hand and check. So after checking, that is where we can say, oh, this person is hypertensive. So that's why we say hypertension is a silent killer. Hypertension is like a time bomb. When the time comes, it will just go off. And the only way for you to know you have hypertension is to check. And once you check, like I also said just now, you don't use one reading to say this person is hypertensive. It has to be series of reading over a particular time. Series of reading, not body have to do evening of one particular day, over a period of time. Then when you see that, you now also know, okay, this person is hypertensive. Then you start to look at the things you need to do for this person. One thing I still need to mention is high salt intake also put you at risk of hypertension.
High salt intake.
High salt intake also put you at risk of hypertension. Sedentary lifestyle, like you just want to sit in one place, get everything you want to do around you. You don't even get any form of exercise. It's also a risk. So by the time we discover that this person would calm down, but if that fails, we resort to the use of drugs. And using of drug is not something that you just use today and tomorrow you said you are no longer interested, or because you are not having any symptom, you just want to stop. And I will still quickly state here, so persons will tell you, oh, they are having headache, is because their BP is high, their blood pressure is high, that's why they are having that headache. I'll tell you, you are actually having a sign of maybe you want to develop a stroke. So some persons could have elevated blood pressure and they don't check, they are not aware. They say they are having headache. Instead of them to go check their blood pressure to be sure of what is happening, they start taking paracetamol and all sorts of painkillers. Meanwhile, that is not what is supposed to...
So you're saying right now hypertension has this relationship with BP? Or they're just the same?
See, BP, because BP, yes. The B is for blood, the P is for pressure. So if somebody say, I have BP, everybody has BP. Because we have blood pressure. Without blood pressure, we'll be alive. But hypertension is when that blood pressure is higher than normal. In a sustained manner.
Some are saying once your BP goes up, it doesn't come down. How true is that notion? You're like, once you have it, it's a death sentence, you have it.
So that's why I said that you could actually have the management. We could check your lifestyle. You can modify your lifestyle. If you modify your lifestyle, the blood pressure will definitely come down. But in some cases, if it doesn't come down, we resort to the use of drugs. And the drug is not something you just take today and you just stop. It's something you take over a period of time. Continuously, in fact, it's for life.
For life?
Yes. Let me use that term, it's for life. So that's why before you place somebody on drug, you have to be sure. And once you're taking the drug, your blood pressure will come down to normal, or even to some normal level to come down. So that's down that it is. It's not an indication that it has been cured. It is because you are on that drug. So when you stop that drug, before you know it,
it goes up
again.
All right, Doc, thank you so much. What advice do you have for some persons battling with hypertension, with high blood pressure, does they have this apprehension that since they have it, it's like, you know, early grave or a death sentence?
Well, first, if you are apprehensive about it, it's a challenge. Because that apprehension will become like a stressor that will further increase the, you understand? So if you have been diagnosed to be hypertensive, definitely you'll be placed on the line of management. Follow it. You know, sometimes we live in denial. We don't want to accept that this is what it is. So instead of us following that part of management, we are looking for alternatives that we want to use. Oh, this is what is working for my BP. This is what is working. This is what, so and so person used it and it worked for the person. So and so person used it, worked for the person. You want to also go and use it.
Some are saying prayers can work. How true is that?
Well, if it is due to stress or some prayers makes your prayer, the stress to come down, it can be. But
yes,
let's just let's adhere to medical prescriptions, medical advice that have been given to us. And let's not forget, exercise is very, very good for
Thank you so much, Doc. Our time is up. Well, this discussion is with Dr. Brighton Novukoko, a medical practitioner, telling you what you should do to just check that pressure. Get your son just be dancing, walking, bam, he or she is gone due to high blood pressure. You have to go out there, check it regularly for a healthy lifestyle. Once more, Doc, appreciate your coming. Thank you so much. All right, that's it on today's edition of Healthy Living. We'll see you again next week, Monday, God willing. Bye for now.